Alright, let's talk about tumor lysis syndrome. Tumor lysis syndrome, we have tumor cell which are lysed. So let's read this first. It is an oncologic emergency triggered by massive tumor cell lysis, seen most often with lymphoma leukemia, usually caused by treatment initiation, but can also occur spontaneously with fast-growing cancers. Release of potassium leads to hyperkalemia. Release of phosphate leads to hyperphosphatemia. Hypocalcemia due to calcium sequestration by phosphate. Increased nucleic acid breakdown, which leads to hyperuricemia, leads to acute kidney injury, which leads to increase in bun and creatinine. Prevention and treatment includes aggressively hydrate, allopurinol, and respiricase. So let's look at this picture now. So basically everything is increased except calcium, and you can just tell because of phosphate. When the phosphate is there, it's going to bind to calcium. Calcium sequestration by phosphate. Okay, in tumor lysis syndrome, everything is increased. Increased potassium, increase in uric acid levels, increase in phosphate, but that phosphate doesn't let the calcium increase, so decrease in calcium. So when let's talk about now each one of them. When the potassium increases, you have the muscle weakness, arrhythmias, and CKG changes. When the calcium is low, you have EKG changes. Okay. And seizures and tetany. When the phosphate is high, it forms the calcium phosphate crystals that lead to AKI. When the uric acid is high, it forms uric acid crystals, and they also lead to AKI. AKI leads to increase in bun and creatinine. Excuse me. So it is one more thing. It is triggered by massive tumor lysis, right? Caused by either initiation or spontaneously. So here it is at leukemia, lymphoma, cancers. So this occurs in cancers with rapid cell turnover. Excuse. Rapid cell turnover. Because you're destroying these all cells, and more common, they all get destroyed, leading to tumor lysis syndrome. That is the thing behind that. Second is the substantial tumor burden. Substantial tumor burden is a lot. And the third thing is, let me just write third up top. You have high sensitivity to that chemotherapy. You're highly sensitive to that, so as soon as you initiate that process, you're destroying all the cells leading to tumor cell lysis.